All right. Thank you for joining this morning. My name is Dr. Doug Wingate. We've got the chat going, so if you have any questions that come up, feel free to drop them in the chat, and I'm happy to address them along the way or at the end, and we'll have some time at the end for questions as well. We are going to talk this morning about a topic I'm really excited about. Really excited about the potential of this pairing of psychedelic therapy, and neurofeedback. And so we're going to talk about how those two things, we're going to talk a little about each one individually, and then how those things can be utilized together in order to maximize or improve the outcomes in terms of mental and physical health and some of the benefits as far as each of those goes. We'll get right into it. Before we get too far into it, we do have a disclaimer just that everything that we're going to talk about today is for educational purposes only. So don't take it as any sort of prescription. Definitely work with either your healthcare provider or your mental health provider in terms of any of the modalities that we're going to talk about today. But this is going to be some uh, foundational information that we can hopefully have discussion around, or at least open more discussion around the potency of pairing these two things together. There's the field of psychedelic assisted therapy and access to psychedelics is in the midst of a huge cultural shift right now. There's a lot of conversation around what's going on. Research is growing exponentially. There are a couple uh, trials and research studies that are headed through FDA hoops that they're jumping through right now. So they're in phase three trials at the moment, both taking a look at, well, there was research around MDMA for PTSD, and then with psilocybin, which I tend to work with. There are two major studies that are in phase three right now, taking a look at psilocybin as a potential intervention for major depressive disorder and as an intervention for treatment-resistant depression. Um, Include alongside that, on the state level, at least in the United States, there's growing access. So I am based in Portland, Oregon. I'm a co-founder of Wingate Sanctuary, a legal licensed psilocybin service center. And through that, and my work with the Integrative Psychiatry Institute, I've had the opportunity to legally facilitate for hundreds of journeys with psilocybin. And Oregon has had legal access for about 3 years now. And there are several other states. Colorado is rolling out their program. New Mexico um, just passed a bill that's going to legalize access as well. Texas just passed millions of dollars for research into ibogaine for PTSD. And then on the global scale, that's also opening up in terms of access and research that's being done all around the world. Fantastic work being done in the UK, out of New Zealand. France is doing research, Scandinavian countries, and um, so there's on a global scale, there's a cultural shift toward um, greater access and also a greater understanding and more research with psychedelics. So there's a lot of conversation. And of course, now there are giant conferences where thousands of people are attending to learn more about psychedelics and the potential for psychedelic assisted therapy and how that can apply. My work has a lot to do with psychedelic assisted neurorehabilitation. That's based out of my background. I've an uh, integrative neurorehabilitation specialist who's been in clinical practice for the last 15 years, primarily working with people recovering from traumatic brain injury, post-concussion syndrome, and stroke, and other complex neurological conditions. And so when I'm working with people, not everybody, but a lot of my focus and my research, at least, is with psychedelic assisted neurorehab. And if you're more interested in that, I have other videos that go deeper into that. All of that is to say there's a lot happening with psychedelics right now. So one additional promising development uh, within the psychedelic conversation is how to get the most out of somebody's psychedelic experience. What sort of integration is going to be really effective, and get people really the results they're looking for, or how you can support one's nervous system, mental state, physical state in a way that's going to build on really the foundation that psychedelics allow for. And one of those is what we're going to talk about today, which is neurofeedback. So this approach is gaining traction for its ability to support both psychological and neurobiological aspects of personal healing, enhancement, and transformation. So we're going to talk a little bit about all of that as we go through. First, what is neurofeedback? If you're not familiar at all, neurofeedback, and this is the definition according to the International Society of Neuroregulation and Research, neurofeedback, or what's sometimes referred to as EEG biofeedback. So, if you're not familiar with biofeedback, it's a method of getting real-time feedback from the body by a number of different means. But with neurofeedback, it's using an EEG. So, it's using leads that are put on the scalp and getting real-time data from the brain, from the nervous system, as far as how it's reacting to the therapy. So, neurofeedback is a therapeutic intervention utilizing a brain-computer interface. So, you're engaging with a computer. An individual's brainwave activity is tracked in real time using a sensor or using the leads that are placed on the scalp, is then interpreted through the software with a decoder. And then the information is used in order to encourage the individual to modulate specific brainwave activity through feedback. So you're creating a direct feedback with your own nervous system based on the information that's coming through the EEG data. So, conventional neurofeedback usually has what you can see in the picture here. You're engaging with a screen, or sometimes it's engaging with auditory tone through headphones. In either event, you have sensors on the scalp that are reading your brain waves, and then you, if you are receiving the therapy, are engaging an active participant in changing responses in your nervous system and responses in your body. So that can be moving your eyes and engaging with the screen. That can be changing your breathing pattern, different ways that you are consciously engaging with the information that's coming through. There's another term, neurobiomodulation. And if you break that word down, neuro, of course, means it applies to the nervous system and the brain. Bio meaning that there's a biological response through the body and not just the nervous system, not just the brain. And modulation means to modulate or introduce change or allow for change. So, according to the International Neuromodulation Society, neuromodulation is technology that acts directly on the nerves. It's the alteration or modulation of nerve activity by delivering either an electrical or pharmaceutical agents directly to a target area. But there are other means of neuromodulation that are not necessarily electrical or pharmaceutical. For instance, in my practice, I do a lot of photobiomodulation. It's using clinical grade cold lasers. They can be used to stimulate both the body and the nervous system. You can do transcranial electrical stimulation. You can do transcranial photobiomodulation, and it actually stimulates different areas of the brain through the scalp because those waveforms through the lasers are able to penetrate deep enough that it moves through the scalp, through the skull, and stimulates that brain area. Another way that I implement that is intranasal photobiomodulation. So it's a laser via the nose through the thin membrane at the top of the nose that easily passes that waveform through and can be very effective in stimulating the brain, clearing out inflammation in the nervous system, and upregulating mitochondrial function, which is your brain and your nervous system and your body's energy capacity. So it helps physically create more energy that your body can put into healing. So there is more than just electrical and pharmaceutical agents, but neuromodulation is a means of modulating the nervous system. Neurobiomodulation is a fast evolving field that harnesses low intensity electrical impulses in order to regulate and restore neuronal activity. It targets maladaptive brainwave patterns, supporting neuroplasticity, and we'll talk more about neuroplasticity as we move forward and what that is, what that looks like, and different ways to support that. But very briefly, it's your brain's ability to reorganize itself through creating new neural pathways. So it's a method to help promote that generation of new neural pathways. So a system that I use in my clinic It's called NeuroGen brain balancing. It's a form of neurobiomodulation. And the reason I use this is it's a passive, non-invasive neurobiomodulation technique that can be very helpful in promoting brain health. So what that means is rather than your conventional neurofeedback, it's taking readings just like neurofeedback is. You're using sensors over the scalp in order to get EEG data. NeuroGen is completely passive, however. So rather than having to engage with the screen, rather than responding directly to an auditory tone or whatever is being used with the neurofeedback, NeuroGen brain balancing, it takes the signals, it decodes it interprets the information that's coming through. And then part of the software component of that is that it's in real time adaptive transcranial electrical stimulation. So it sends back a low intensity pulse transcranial electrical signal. It's imperceptible to most. Some people who are particularly sensitive might have an awareness that it's sending a signal. If so, that's a very mild buzzy sensation, but most people don't even feel it. NeuroGen is really doing the work of neurofeedback for you. And this works really well for the type of people that I tend to work with. Like I said, a lot of have history of neurotrauma, so traumatic brain injury, stroke recovery, post-concussion syndrome, and a lot of the time screens can be overactivating. It can be too much. It can be very visually stimulating, and a lot of the time there are already visual deficits, or or tracking with your eyes can cause vestibular issues, so dizziness, nausea, um, really severe fatigue if the nervous system is not in a place to do all of that activity quite yet. And this also opens it up to being able to work with more diverse populations in terms of I can work with infants, I can work with little kids. They respond very well to this. And they don't really have to do anything. The system and myself are doing everything for it. So this is an option that I use in my clinic in terms of neurofeedback and often pair alongside the psychedelic work that I'm doing. And this applies to neurogen and neurofeedback as a whole, a number of different conditions that it can be helpful for, neurodivergent situations, especially with acute nervous system dysregulation. So being overstimulated, being really amped up, and being unable to re-regulate yourself with things like ADHD and individuals on the autism spectrum. Um, Emotional dysregulation, so people who are really prone to anger or even working through grief or just an inability to regulate themselves emotionally. This can be very helpful because it supports re-regulating the nervous system at a foundational level. So with that anxiety as well, academic performance, it helps re-regulate the nervous system so that the nervous system, your brain, is working much more efficiently and often with a lot more clarity. So you'll also see focus and brain fog on there. A lot of individuals will report that they feel like their thinking is a lot more clear or a lot more efficient. So it can be used for academic performance as well as athletic performance. And with that, uh, with neurobiomodulation, you're able to work directly on the body. So some of the leads can be applied to areas of the body as well. If, for instance, there's inflammation or an injury or something like that. But also by supporting the brain and the nervous system, you're supporting how the brain communicates to the body. And if your brain is functioning more efficiently, it's sending those signals to the body more efficiently. And so it can really increase one's athletic performance or how that feedback between the body and the brain is working, making that much more efficient. Chronic fatigue, I mentioned my work with concussions, depression, fibromyalgia, and chronic pain conditions, chronic inflammatory conditions. Executive function is your brain's ability, the higher cognitive functions of things like making judgments and multitasking, which can sometimes often be problematic if, one, if we're really stressed out. So stress inhibits executive function. It can strongly impact executive function. So if we're in a chronically stressed state, or a constantly activated state in situations like PTSD, which is also listed on here, executive function can be really impaired by that or really impacted. And again, by re-regulating the nervous system or giving the brain prompts and ways to re-regulate itself, it can be really helpful in improving executive function. Insomnia, sleep issues, sometimes are some of the first things that people notice improve once beginning neurofeedback or NeuroGen. Migraines, and I have another talk coming up in a couple weeks about migraines, and another talk next week about PTSD and traumatic brain injury, and the neurofeedback and the NeuroGen. So if you're interested in those things, much more information in the next couple talks that I'm giving. But we mentioned stress, stroke, Tourette's and movement disorders. There's Parkinson's protocols that have been used effectively as well in reducing symptoms around that, both cognitive symptoms, emotional symptoms, and the actual motor symptoms themselves. So, at its foundation, what we're going to be talking about with both of these, but certainly with neurofeedback, is about neuroplasticity. And as I mentioned before, briefly, neuroplasticity is the brain and the nervous system's ability to change and to rewire itself. It's the ability to have a plastic nature, as in moldable or malleable. So it's able to adapt to change more, and it's able to create new neural connections as a response to that. We have areas of the brain that continue to have, it used to be thought that during development, the brain had a lot of neuroplasticity because it's learning, it's making new neural connections, and as we hit adulthood, neuroplasticity stopped. And that was the assumption for a really long time. And now we understand that neuroplasticity, the brain is continuing to make new neural connections and continuing to heal itself and adapt throughout adulthood. There are a couple areas of the brain in particular that are more neuroplastic than others. So, like the memory centers of the brain in the hippocampus and the olfactory bulb associated with our sense of smell have a lot of ongoing neuroplasticity through the rest of our life. But as we learn more and more about the brain, we're finding that this neuroplasticity, while it tends to slow down in adulthood, it's not nearly as efficient, that it does continue throughout our lives. And there are ways that we can utilize that and be aware of that. And there are ways that we can increase that neuroplasticity. And neurofeedback is one of those ways. You're working directly with the nervous system to help promote adaptability and promoting change and the ability to change and create those new neural connections. So neuroplasticity may also be referred to as neural or brain plasticity, the nervous system's capacity to modify its own activity in response to intrinsic or extrinsic stimuli. That just means internal feelings or what's coming in from the outside world by reorganizing its structure, functions, and connections. Understanding and harnessing neuroplasticity can have really significant implications within new developing therapeutic strategies that are out there. That includes neurofeedback, that includes the passive neurobiomodulation for sure. And it also includes psychedelics, as we'll discuss. So these approaches where we're looking to support and promote neuroplasticity can be very helpful and are aimed at enhancing cognitive function, learning, memory, and facilitating recovery from neurological disorders. There's also a term out there, metaplasticity, and this gets talked about a little bit more in the psychedelic realm. But I talk about it when I'm teaching my neuroorthopedics to my students. We talk about metaplasticity because plasticity, meta means self-referential. So it's the plasticity of plasticity. It's how plastic something is, how adaptable something is. And this applies to, as we're talking about it here, synaptic plasticity. So the definition of metaplasticity is a change in the ability to induce subsequent synaptic plasticity, such as long-term potentiation or depression. So how responsive the nerve fibers are firing, how responsive the nervous system is to information that's coming in. So metaplasticity is considered a higher order form of synaptic plasticity. how this applies in everyday ways that I approach it clinically is that there are different things that influence our nervous system. Excuse me, and there are different um, ways in which our nervous system becomes more plastic or less plastic. So there can be a lot of different influences on that. The time of day can actually influence how plastic your nervous system is. It waxes and wanes throughout the day. There's how much stimulus, how much information your nervous system is processing at any particular time. And then other things that you may be putting into your body. So psychedelics is one of those that greatly increases neuroplasticity. So it increases that ability. But other things like if somebody has um, drinking a lot of coffee in the morning before coming in for a treatment, that's going to influence their nervous system. It's going to influence how receptive their nervous system is to information. If they're a smoker, and how nicotine influences the nervous system. So there are a number of different things that influence how receptive your nervous system is to information. And that's important to know, and that is how metaplasticity comes into play. The fact that your nervous system is responding in different ways, depending on situation, time, is what metaplasticity is. So with psychedelics, moving into that side of things, there are what are referred to as critical periods of neuroplasticity or critical windows of imprinting. And so I talk about this in more depth in some of my previous talks, but very briefly, a psychedelic increases the neuroplasticity in the nervous system. Um, Most psychedelics, certainly psilocybin, is considered a psychoplastogen, and by definition, what that means is that with a single dose, there's a marked increase in neuroplasticity in the nervous system during the journey itself, during the psychedelic experience. And also, the second sort of requirement to be a psychoplastogen is that there are long-standing changes over time or a window in which the nervous system and the brain continues to be very plastic, have this increased neuroplasticity for an extended period of time. So that extended period tends to be a little different, but depending on what psychedelic is being used. And a lot of the research points to duration of the journey or the psychedelic experience or trip itself seems to be correlated with how long the critical window of neuroplasticity lasts after the journey itself. So, for instance, ketamine is a relatively short-acting psychedelic experience. It's about an hour or two, and the critical window for ketamine seems to be about a week, maybe two. With psilocybin, MDMA, the journey tends to last longer, about 4 or 5 hours. Um, Definitely depends on metabolism, sometimes shorter, sometimes significantly longer. But the critical window for those substances seems to be about 3 to 4 weeks, up to about 30 days or so. LSD, a little bit more potent. The journey tends to be a little bit longer than that, usually 6, 7 hours, 8 hours or so. And the neuroplastic window for that seems to be about 4 or 5 weeks. And then there's another um, psychedelic known as ibogaine, and I mentioned that real briefly in terms of Texas passing some funding for research into that. There's all kinds of um, things to keep in mind with ibogaine. It's a very, very potent substance. The journey tends to last anywhere from 36 to 72 hours, significantly longer than the other substances. There are uh, risks with that. So there are cardiac risks to the heart, and often um, when people are undergoing ibogaine therapy, they're in a hospital setting, having their heart monitored and having their pulse rate and their oxygen levels monitored. So I want to mention that because there are some cautions around that, but also some very intriguing research that's coming out, and also different ways that might allow for a little bit greater safety there. But ibogaine, because it has a significantly longer uh, journey, significantly longer trip, the critical window for neuroplasticity also seems to be longer. So, Gold Dolan is a researcher who has done some amazing research into the critical periods and how psychedelics influence that. And with her work, they've seen that ibogaine has at least a 4-week window of neuroplasticity. It hasn't been gauged beyond that, so can't say for sure exactly how long that critical period is. But all of that is to say that the duration of the journey seems to be correlated to how much neuroplasticity and how long that neuroplasticity lasts. Um, so what Goal has said based on her work and taking a look at psychedelics, she started taking a look at MDMA and started working with mice and then octopi, and then has then with MDMA, and then has then branched out to explore that how it applies to other psychedelics and finding that these critical windows vary depending on the substance and depending on the journey length. So, what Goal has to say is that psychedelics are a master key for unlocking critical periods of neuroplasticity, of receptivity of the nervous system, that there are a lot of different critical periods that our body has. So, we're starting to get a sense that a lot of the critical periods close during the same sort of governing principle, the same sort of molecules, if not the exact same molecules, and will or have been implicated in the closure of, say, the visual critical period or the touch critical period or the motor critical period. Each of those are different periods of time during our development as a human being, usually early in life, where we have would have also been referred to as neurological imprints that happen during different stages of development. So, for instance, with touch, if a small child, if an infant isn't given touch, nurturing touch early on, the nervous system doesn't get that feedback that it's expecting, and it can cause developmental delays. It can cause um, sensory information to be associated really negatively, where um, the person, as they continue to grow up, they haven't had that feedback early on when the body is particularly receptive to it, and so they don't develop the same level of development that others tend to who are exposed to that. And the same sort of thing for visual critical periods early in life. If you don't get the visual input early in life, then the eyes don't develop the same way that they would be expected to. Another example of this is like the language critical period, where if you expose a young child to multiple languages, it's a lot easier for them to learn those multiple languages or gain the sounds to be able to hear particular sounds. It's been shown if you're early in life, you're only exposed to a single language, and then later in life exposed to another language that has sounds that are not in that first language, that you may not even be able to register or process those particular sounds because they're so foreign and your nervous system hasn't been exposed to them during these critical periods. So critical periods apply to different phases of life. And then what they're finding with psychedelics is that psychedelics have the ability to reopen critical periods for what can be referred to as re-imprinting or metaprogramming these imprints that have been taken on through the developmental stages. So, why would you consider combining psychedelics and neurofeedback? Both help enhance neuroplasticity, both foundationally support the nervous system in allowing for greater neuroplasticity. In order to help support emotional grounding, neurofeedback can be very helpful if somebody has a psychedelic experience in order to help integrate that experience, to help meaning make, and certainly to help regulate the nervous system or activation patterns. Sometimes there's a lot of information to process after that. A lot of emotion can come up, a lot of deep-seated, sometimes repressed material can come up. And neurofeedback can be very helpful in helping re-regulate the nervous system and work through that and process that information. It can help facilitate clearer cognitive processing. So again, if you're working through the material that's come up during a psychedelic experience afterward, it can be very helpful in physically having the capacity to process those things. And it can help reinforce and integrate therapeutic insights. If people have epiphanies, if they have worked through some really deep-seated or repressed or subconscious material that comes to the surface, neurofeedback can be very helpful in, again, regulating the system, regulating the body, regulating the nervous system, and working through those things, or at least allowing for a foundation where people feel more regulated and lets them work through that and process that material more efficiently and feeling more safe in their body and their nervous system while doing so, which can be a huge component. So together, both of them can help clients experience not only deeper transformation, so it can deepen the process, it can also allow for a more stable and embodied integration process. When I'm working with people with a psilocybin journey, depending on what they're coming in for, ways that I've applied this is that I've had individuals come in and do some neurofeedback or NeuroGen sessions before a journey to help regulate the nervous system as much as possible. And it tends to help them feel more regulated and thus a little bit more receptive to stepping into a psychedelic experience, especially if it's their first time with a psychedelic journey. And then also on the other end of that with integration, it can be very helpful. It's not uncommon for me to have somebody come in very shortly before the journey, the day before, a couple days before, and then come back in for an integration session of NeuroGen the following day, or usually 2 days out. I often recommend that people give themselves about 24 hours of just hopefully some non-stressful time to sit with the experience the day after the journey. I've certainly had people come in the day after. It hasn't been a problem at all. But if people can allow themselves a little bit of spaciousness, that can be really nice just to um, sit with that experience and let their nervous system really settle in after that. Spend some time outdoors. Something like that can be really helpful, and then have them come back in, and then we can continue to work with that over time. So, if you're a psychedelic facilitator, you're working with individuals and facilitating journeys for people. NeuroGen or neurofeedback can be a really supportive ally in this work. So whether or not you're working with ketamine-assisted psychotherapy, which at least in the United States, it's more accessible across the country, or if you're working with psilocybin-assisted therapy, as I am, or any sort of psychedelic-assisted therapy approaches. As I said, it can be neurofeedback can be a supportive intervention prior to sessions, so it can help reduce anxiety going into the journey space. Again, especially if somebody hasn't has had a psychedelic experience before, there can be a lot of lead up anxiety. There's a lot of unknowns. What's going to come up? What is in my subconscious that may come up? What emotions may I need to process? What sort of trauma is going to be worked through from my past, and how intense is that going to be? And also, if they don't have experience with being in an altered state, there can be some anxiety around that, and just a lot of the element of the unknown. So, it can neurofeedback can be helpful in sending signals directly to the nervous system to regulate itself. And that can be helpful in reducing that anxiety, regulating the nervous system, and increase their general readiness going into a psychedelic experience. After sessions, in terms of integration, it can be helpful in stabilizing emotional responses. So sometimes when there's a lot of emotional material, you don't know where to start, and people can feel pretty frazzled. The psychedelic experience itself can be very intense. A lot of people will report like they may not have moved a whole lot during their experience. They may have just sat on the couch or laid on the bed for 5 hours, but they've done a lot of internal work. They've done a lot of internal processing, and they feel like they've ran a marathon in terms of just working through a lot. And neurofeedback following a session can really be helpful in stabilizing that or reinforcing a solid foundation where people can approach that from a more steady state. It can reinforce their insights that they may have had from their experiences, and it can help mitigate dissociation or feelings of being overwhelmed by the amount of material that was brought up or is being processed. Integration can sometimes be a long process depending on how much information comes up. And so I always let people know, like, don't rush that. Don't feel like you need to make meaning out of your experience immediately. Take some time, sit with it, and neurofeedback can be very, very helpful in allowing for that nervous system regulation so it doesn't necessarily feel rushed or that they don't feel overwhelmed on a physical level or their things aren't firing too fast. It just kind of helps slow things down and settle into the present processing a little bit easier in my experience. And then between sessions, so if, for instance, we're doing microdosing, which is done repeat sessions over a period of time, or sometimes there can be a series of psychedelic journeys at a macrodose. So there are MDMA programs that will do 3 sessions. I've done similar things with psilocybin work, and in between those sessions, neurofeedback can be used or can be a helpful tool in maintaining the momentum of that neuroplasticity in the nervous system. So it just helps support that neuroplasticity on an ongoing basis in between those psychedelic journeys that really open the door for a lot of very active neuroplasticity. So by adding the neurotechnology, the neurofeedback to the support and toolkit as a psychedelic facilitator, you may find that your clients experience smoother transition and deeper long-term integration as part of their process. For those who may be already working with neurofeedback in the mental health realm, or mental health professionals, the pairing of these two can help expand therapeutic horizons. So clinicians who may already be working with neurofeedback or EMDR or talk therapy or somatic therapy approaches, understanding the role of psychedelics in catalyzing the neuroplasticity can help better support clients in integrating their experiences. So there are early findings that suggest combining EEG-based feedback, neurofeedback with psychedelic-induced neuroplastic windows can enhance treatment outcomes in different conditions, including depression and anxiety, PTSD and trauma recovery. And then, again, I'll be giving a more extensive talk on PTSD next week if you're interested in that. Addiction and behavioral patterns, existential and spiritual distress, which can certainly come up following a psychedelic experience. People will have these transpersonal, unitive, ego death experiences, and that can be a lot to process. It can raise a lot of existential questions that then they need to sit with and process and try to make meaning of that and what to do with that experience and that information that was gained from the experience. So, for providers interested in integrative approaches, the emerging pairing of these two things, neurofeedback and psychedelics, opens new frontiers in consciousness-informed therapy. And in terms of research, this has been looked at, it has been researched, and there are a number of different studies out there and a number of different articles that you're welcome to take a look at. I have an article up on my website that references these and talks about it a little bit, but I implore you to explore it deeper and look into the research if it is something that you're interested in having more information about. Um, in one paper here, psilocybin-assisted neurofeedback shows promise. The quote, or they say, this early research shows that psilocybin-assisted neurofeedback is feasible and well tolerated, that the novel approach could open new possibilities for treating cognitive symptoms that cut across many mental health conditions. A 2024 study said that psilocybin enhanced neurofeedback could offer significant lasting benefits across diagnoses, so for a number of different conditions, improving daily functioning. A study by the Open Foundation, taking a look at harnessing psychedelics for neurofeedback, found psilocybin, by enhancing neuroplasticity, could help unlock the full potential of interventions like neurofeedback, paving the way for more effective personalized treatment. So, a lot of the way I've kind of geared how I've talked about this so far has been if somebody is pursuing psychedelic assisted therapy, how neurofeedback can complement that. This took a look at sort of the other way around. So, if somebody is actively receiving neurofeedback therapy, that psychedelics might be given consideration to complementing that or opening up that window of neuroplasticity where somebody would be more receptive to the neurofeedback. And that's a lot of how I work with the psychedelic assisted neurorehabilitation with people with stroke and traumatic brain injury and concussion. Is that often the psilocybin in this case, or the psychedelic, is sort of used as, in that experience, is used as a tool to facilitate neuroplasticity. And then the other interventions that we may be doing, whether or not it be physical therapy, um, non-invasive brain stimulation, active functional exercises, dietary changes, or the neurofeedback, the NeuroGen, that psychedelic is allowing the neuroplasticity so that the nervous system is more receptive to those modalities. And that's a lot of the work that Gold Dolan is also doing now, taking a look at stroke recovery and individuals that are sometimes years out from a stroke. So you have a critical window with stroke recovery where the nervous system is very receptive, and that's a few months after the stroke. And then that window sort of closes, and it's a lot more difficult to make any sort of significant change or improvement. And it seems to be that the psychedelics help reopen a critical window of neuroplasticity where the nervous system is again very adaptable, very receptive, and bringing in those healing or therapeutic modalities, can the body and the nervous system will then once again be receptive to those things and creating change and healing from that. So really interesting arena in that as far as that goes. Um, and then there is an article from Psychology Today integrating neurofeedback with psychedelic assisted therapy. If you want to dig deeper into this, that's a great general article that came back and said neurofeedback can be used during the preparation phase of psychedelic assisted therapy to help develop openness, acceptance, and surrender, sometimes letting go can be a really hard thing for people when it comes to the psychedelic experience. And so they'll find themselves with resistance to the journey itself or to the altered state and to letting go. And so it can, pairing this or the neurofeedback can help soften that personal boundary so that surrender or that letting go or just um, receptivity to the experience can be a little bit softer, a little bit easier. It can also be used during the integration phase in order to train desired brain states or to reinforce the afterglow effects that follow a psychedelic experience. So, what we do with that information. If you're interested in this pairing, there is a really interesting documentary out there called Crossed Paths: Ancient Wisdom in Modern Science. You can go to it's put out by New Mind. It's the whole thing is up on YouTube, so you're welcome to go watch that. It's pairing ayahuasca and neurofeedback, which is really interesting. And they also discuss how the ayahuasca experiences and the findings with neurofeedback, with EEG, the EEG findings with neurofeedback. They draw comparisons to how the brain, how the nervous system is responding to both of those experiences, and so how there's overlap with those. So, really interesting watch. Go check that out if you're interested in how ayahuasca and neurofeedback have overlaps as well. That's about what I have for you. My information, if you want to reach out with questions, um, my website is acuneuromodulation.com. That has information about all of my services, including the neurofeedback, the NeuroGen brain balancing. That's, as I said, I'm located in Portland, Oregon. So NeuroGen Brain Balancing of Portland is where I do the neurofeedback. I'm also the co-founder of Seven Gate Sanctuary, where we offer psilocybin journeys. The, and then if you're interested in that at all, sevengatesanctuary.com. Both of those have ways to contact me if you want more information.